is a struggle for so many teens, and acne can be just as bad for adults. Dr. Jo Kerns is from Dermatology of Greater Columbus with some simple solutions for us this morning. Thanks for being here.
Thank you for having me.
Okay, so the question is, why do we see acne? I mean, some people never get rid of it, but some people it comes back later in life. Why is that?
That is so true, and it's quite frustrating for adults especially to have acne. You know, there are three main reasons that we have acne. One is that we just make too much oil.
Yeah.
Another is that the bacteria that lives in our skin can overgrow. And lastly, our pores just get plugged. For women, additionally, hormones actually do play a part in acne.
Okay, so what about dirty skin? Because I know my mom growing up, she always said, you're going to get pimples if you don't wash your face. Is there some truth to that? You said the blocking of the pores. Is that true?
Our pores do get plugged. However, scrubbing only makes acne worse. Our patients are squeaky clean, so scrubbing we actually discourage.
Really? So no scrubbing, just lightly exfoliating?
Exactly.
Okay. When it comes to treatment, there are several options for people, right?
That's exactly right. In fact, because there are so many reasons that we have acne, each treatment targets a different mechanism of the acne. So oftentimes it takes multiple products to get a patient clear.
Can it actually be cured, though? Because a lot of people struggle with this.
Absolutely. So patients should not give up. We have many things that we can use. There's one medication in particular you may have heard of, isotretinoin. It comes under different brand names such as Accutane, Amnestine, Clarivis, and Sotret, and that actually can cure patients.
I've actually used Accutane, I will admit it right here and now, and it's done wonderful things for my skin, and I know a lot of people that have had. Do you recommend that, though? Because that is kind of like the last straw. That's a very intense treatment.
I have many patients on isotretinoin, and I myself was a patient that was treated with that medication too. So in the appropriate setting, I think it's a great medicine to use. And of course, we monitor closely. Patients see their dermatologist monthly when they're on that medicine.
And it's not necessarily something, though, for someone that has a few pimples here and there, right? It's more
not
of
always
an aggressive treatment.
Right.
Okay, so what if you just have a pimple? I mean, is there something that you can put on, like just a spot treat if you get one every once in a while?
Absolutely. We have several great over-the-counter products to start with for patients. Look for active ingredients that have benzoyl peroxide or salicylic acid, basically.
Okay, and you've got some stuff with you here. Do you want to mention any of this stuff?
Sure. So some of the over-the-counter things that you can purchase in the stores, such as Panoxyl Bar, Persagel, and the Neutrogena products are quite helpful for patients that are seeking quick treatment and don't have their appointment yet with their dermatologist. And then on the prescription side, we have many treatments, both topical as well as oral. Some work as retinoids, others are antibiotics, so quite a few.
What about side effects? I mean, do you see a lot of side effects with these treatments?
Well, topical side effects, typically it's irritation, redness. Of course, a lot of our products dry patients out a little bit. Oral antibiotics, I'd say the most common side effect would be GI distress or, abdominal pain.
Small side effects for what it's really going to do, because we all know what acne can actually do on the inside, not the outside.
Exactly.
Yeah, it can be extremely depressing to have acne, and it causes a lot of problems. How long do you think patients, I mean, is there a point where we just outgrow this, or is it something that you can really have the rest of your life?
Some patients do seem to outgrow their acne, where we just treat them for a short while and eventually they simply stop making their acne lesions. For others, however, it's quite frustrating and very long drawn out course, and in that case we reach for those more stronger medicines that we had talked about earlier.
All right, Dr. Kerns, thank you for joining us this morning. If you do have a problem with acne, she can help you out, so come and see her for more information. Thanks for being here.
Thank you for having me.
Dana.